Hey, Dr. Seema here. Do you remember when you were a young mom and you got up with the baby once and you were like, I can't believe I had to get up with the baby. And then the baby got up twice and you were like, oh my God, I was up twice with the baby and I'm so tired. And then sometimes it would be 3 times or 4 times in the night, whether you had to get out of bed or not, or the baby cried, but for some reason your sleep was disturbed and you were so tired the next day. Your brain felt heavy and foggy. You may have had a headache. You were just kind of out of it. You couldn't actually function at your normal level. Now fast forward 20-25 years, and as we enter menopause, many of us are going through a similar type of sleep pattern, but instead it's called obstructive sleep apnea, where the actual airway, the mechanisms of the airway, the physical anatomy changes and the airway becomes smaller. And as a result of the tongue position in the airway, everything gets a little bit restricted as far as airflow. And you might have a little bit of a snoring or something like that. But the big key factor here is, according to the American Academy of Sleep Medicine, up to 4 wake-ups an hour is not considered sleep apnea. An hour, not a night. So that means that if you have up to 4 wake-ups an hour and you went for a sleep study, they'd be like, no, you're fine. You don't have sleep apnea. And then if you had, for instance, between 5 and 15, they would be considered mild sleep apnea. 5 to 15 disturbances an hour due to low oxygen or lack of oxygen to your body and brain. Then moderate comes into 16 to 29 wake-ups per hour or disturbances per hour. And severe is 30 plus, and therefore requires some sort of medical intervention, like a CPAP or something else, a discussion to have with your doctor. My question to you is, how is 4 wake-ups an hour even possible or acceptable? And why are we just okay as we get numb when we have young kids and we're kind of like functioning at this level, and it's like, oh, you have a baby and this, that, you're just, you're adjusting to the lack of sleep. But now at this age, with other risk factors and our body's just getting older and less able to handle and withstand certain stresses, that 4 wake-ups an hour, which would still be considered normal, it has a huge implication on your body. So you need to start looking at how you feel. How do you feel? Do you wake up with a headache? Are you waking up very, very tired? Do you take long daytime naps? Those are all signs of an incomplete sleep over the night and not getting enough recovery and not getting oxygen, and signs that you may have some form of sleep apnea. Now, as a dentist, people will often come to the dentist and ask for a dental appliance, a mandibular repositioning device that pushes the lower jaw a little bit forward so that you actually open up the airway a little bit more. And if you need one, do it. 100%. If you need to do whatever you need to do to get oxygen to your body, then please do it. But understand that the repositioning temporarily is not a solution permanently. That understanding what changed in your anatomy, whether it be from inflammation, whether it be from muscle tone, whether it be from fat deposits around the tongue or the base of the neck, those are your root causes that you need to get to so that you address that and you can actually get oxygen flowing through your airway, into your body, into your brain, and wake up feeling refreshed and having all of your body functions function normally and reduce your risk factors. Hey, Dr. Seema here.